Welcome to Walking Radio, a podcast dedicated to amplifying the voices of people on the front lines, those most affected by decisions made far from their reality. This is a space where lived experience takes center stage, where stories are shared on their own terms, and where conversation happens in motion, sometimes literally walking and talking. For the foreseeable future, Walking Radio will focus on the closure of supervised consumption and harm reduction sites across Ontario. These spaces save lives, and their loss will be felt hardest by the most vulnerable among us. People who are our friends, neighbors, and loved ones. Through interviews that are trauma-informed and rooted in full consent, we'll hear directly from frontline workers, healthcare professionals, and those whose lives hang in the balance. For this first episode, we're starting with the voices of nurses. Recorded at the Registered Nurses Association of Ontario's Summit on Mental Health and Substance Use on March 19th, 2025, we heard the perspectives of healthcare professionals working in harm reduction, in hospitals, and on the streets. These aren't clients, but their lives are still deeply shaped by these policies. The scheduled closures of supervised consumption and harm reduction sites across Ontario will not just affect the people who rely on them to stay alive. It will also impact the people who have dedicated their careers to keeping them safe. This isn't polished journalism. It's real, it's raw, and it matters. I'm Patrick Corvin, and this is Walking Radio. Okay, so it's just going to be improvised, essentially. So, definitely. Shall we walk? Yeah. So, my name is Patrick Corvin. It's March 19th, 2025. I'm here at the RNAO conference near Pearson Airport, and I'm here with my very first guest, and I'm so pleased. Please, of course, whatever level of confidentiality or anonymity you like, I'd love to hear who you are and what your research is about, and yeah, just a little background.
Okay, hi, Cheryl Forchuk here. I'm a nurse by background as well, psychiatric mental health nurse, so thrilled to be here. I do systems level research around change, primarily people with mental health challenges, including addiction and substance use issues, but also do a lot of work in relation to homelessness because of the overrepresentation of that population within that group. And harm reduction stuff is definitely part of my bag of tricks.
Well, you're exactly the sort of person I'm hoping to talk to. One of the major issues on my mind right now is the planned closures of the supervised consumption sites, which is slated for the end of this month. Would you be willing to give your thoughts on what that might entail, what that might look like, and what your immediate concerns might be?
I have many immediate concerns. The people that will die. Obviously, the focus on treatment is wonderful to have treatment available, but you don't get treatment if you're dead. And that is certainly my immediate thing. We know that addiction is complex, and people it does happen, but people rarely get past it at their first attempt. If you think of people, the general public, just think about food as one of addiction. How often do people have 100% success the first time they try to lose weight if they did make that as a priority? We've known for years, I remember tobacco, people used to say it would take 12 tries. Now it's over 20 tries. So why would you expect that any other substance would be somehow easier to get through? And that may not be people's choice. People are using for a reason. It's often related to other events, trauma events. There may be other things going on. There may be other priorities in their life right now that they don't have the bandwidth to also deal with that. And we have to respect where people are at. And the way we respect that is to support the decisions they are making and to make sure that if they are continuing to use that, they can do it in a safe manner that doesn't kill them.
Amen. What you were talking about, the traditional association with many substances and addictions is it can take many, many attempts.
Oh, yeah.
And it feels like we're willing to grant the leeway for people to try as many times as they need to quit smoking. The major distinction between tobacco and fentanyl is, of course, one slip, and that could be fatal.
Absolutely. Absolutely. And any kind of addiction. I always like Stanton Peele's early work, a classic that talked about love, sex, and addiction, that basically said anything that makes us feel better without addressing the underlying problem can be addictive. But dealing with the underlying problem is never an easy thing and never a fast thing.
That brings me to another question is, what would you say are some of the major misconceptions that you would see from the general public and or from policymakers regarding this issue with the supervised consumption?
Well, that is such a large list. But one of the things I would like to point out, if we don't have safe consumption sites, because it's so difficult, it's such a complex issue, it doesn't mean substance use stops because you don't have safe consumption sites. What it means is you now have unsafe consumption sites, and the world becomes an unsafe consumption site. So that's really the choice you make. Do you want a safe consumption site or an unsafe consumption site? It's not that you're going to eliminate consumption by eliminating safe consumption sites. The other issue is around forced treatment, which in terms of basic human rights is certainly something to be a major consideration, but also consider many people using substances are already wanting treatment and on long waiting lists. So I think we need to be increasing the treatment and the accessibility of that treatment so that people don't end up being forced into private options that they can't afford or no options because they can't afford. We need to increase, for sure, treatment options so that they're fast. When people are at a point of readiness, given that people who want treatment are unable to access it, the idea of somehow having people who don't want it accessing it just seems bizarre.
Right, that's such a great point. I often am kind of struck by this image that has formed in my mind of, it's almost as if the provincial government has this idea that there's some sort of master switch you can pull where you just turn everybody to an abstinence-based approach.
Oh, yeah.
And where so many of us have been just begging for decades for enhanced treatment and mental health programs.
Absolutely.
So why, now in this moment that is being granted, just shut off life-saving services at the exact same moment?
And I've worked in the addiction field for so many years. In fact, that prior, when I had set up drop-in centers as a nursing student where we were addressing these issues. My first job after I graduated as a nurse, which, by the way, next year is 50 years.
Wow, congratulations. That's incredible.
In addiction. And I can remember dealing with issues of these same issues around stigma discrimination. My master's thesis when I went back was on stigma discrimination. It's really disheartening. 50 years in the field to be dealing with some of the same stuff. And WHO back in the 1950s, World Health Organization, had statements that it is not a moral choice. And I would say in terms of misconceptions, that's probably one of the big, that this is somehow a moral choice versus the complexity that we're talking about in it. And addiction is an illness like any other illness, and should be available for those who want it. People who are diabetic and don't see the doctor, we don't lock them up. People who have heart disease that have a diet that's not, we don't lock them up. So we don't need a different standard, but it is very. I wish that I could say we'd made more. We do make progress, but then sometimes we seem to circle back to these older, very value-laden, stereotyping kinds of things over and over, and we have to resist it and move forward and recognize the rights of the individual, regardless if you've got diabetes, heart disease, or anything else. That you do make some choices, but the main choice is around readiness. And I think that's really important. When I worked in the alcoholism program, I remember the government had this big thing about awareness of addiction to seek treatment, but our waiting list was already 6 months. So what good does an awareness program do without shortening that stay? And I always worried that if somebody could apply to the addiction program and stick it out for 6 months, it was probably the people that could have managed on their own without an addiction program. The ones that really need those programs are the ones that can't wait 6 months.
Yeah, that's something that I've always found so frustrating, is like the stigma and the misconception around people somehow like not wanting treatment or not seeking treatment when you have so many clients who are just desperate for treatment, desperate for help, but the help is not there, or they're on a wait list for months and months and months, and sometimes many die on the wait list.
Sometimes 2 years. I've known people on waiting lists for 2 years. They do die on the waiting list, or they solve the problem on their own, but very often they die, they relapse, they have to go through detox yet again. It's definitely a problem. We do need more treatment services. We need the whole spectrum of services, but part of that spectrum is safe consumption sites to keep people alive.
Absolutely. I know we have to get back to the conference, but
Thank you so much.
My pleasure. If you had something you could say to the health minister, to Doug Ford now, what would that be?
I would say think about addiction more broadly in terms of these things that we all do to try to cope with problems, and think about how difficult that is, and then multiply it and see anyway, and I know within his own family he's had that
he famously defended his brother globally when he was an object of global scorn, defended his crack use, and was compassionate towards his brother.
So use the same empathy for everyone else with the same problem.
Precisely. Couldn't have said it better. Well, thank you, Cheryl. Okay. It's such a pleasure, Dr. Forchuk. Thank you.
Thank you. Always love chatting. Thank you.
Likewise. Thank you. Okay, fabulous. So it's Patrick Corvin here with our first episode of Walking Radio. We're at the Registered Nurses Association of Ontario's Summit on Mental Health and Substance Use, and I am joined with a very esteemed guest who I will allow to introduce themselves.
Hello, my name is Sarah Lynn Miliajo, and I am the Lakehead Chapter Chair of the Registered Nurses Association of Ontario.
Wonderful. It's so great to have you. Thank you so much for chatting. So the big focus right now that is on everyone's mind is the scheduled closure of the supervised consumption sites. And I understand that Thunder Bay has a site and it's slated for closure. Can you talk about what the potential impacts and the significance of that is?
Yes, I absolutely can. So Thunder Bay has Path 525. It is our only safe consumption site in Thunder Bay. And it is actually set for closure because of its proximity to Ogden School. And so that's why it is set for closure. The impact that it's going to have is that Thunder Bay is disproportionately affected by the toxic drug supply. And we do have per capita the highest in the province opioid-related deaths. So we're going to see the huge impacts with that closure of the site because Path 525 had the ability to test drugs, the ability for people to do the drugs there safely, and also with a registered nurse. When that closes, they're going to not be able to test their drugs. They are honestly going to have more overdoses. That's going to impact the only acute care facility in all of Northwestern Ontario, which is the Thunder Bay Regional Health Sciences Centre. You're going to see more of those patients showing up in Emerge, and hopefully the outcomes are good, but I can anticipate that there'll be far more opioid-related deaths.
Yeah, that's the big fear. What would you say are some of the misconceptions that the public and policymakers have around supervised consumption?
I think the misconception is that we are enabling people, which is not the case. We're providing them a safe place to do it safely, to be able to test the supplies that they're getting, to give them the safe supplies so they're not reusing needles. They're able to be monitored while they're using drugs. And so it also can be a gateway for them to be able to positively make changes. So then referrals to different services that are available within Thunder Bay, if they do choose to want to get clean, it opens the door for them. So it's not enabling them in a sense that we're just giving them drugs. It's just giving them a safe place to do that. And so it is harm reduction. There's such a stigma still around it, particularly in Thunder Bay, but I would like to see us break down those barriers to provide better care for people who have substance use disorders.
Yes, speaking of the clients themselves, do you have any, without naming names or anything or identifying information, do you have any specific clients or specific stories that come to mind that you're worried about during this transition with the closures?
Yeah, one of my best friends is struggling with substance use disorder and addiction. And it's something that I'm particularly concerned for because I don't want her to die. I want her to be able to receive the supports and the care that she deserves. I want her kids to have a mom. And so, yeah, that's a constant worry every day, every night before I go to bed.
What is something that you would like for the Premier of Ontario or the Minister of Health of Ontario, Sylvia Jones, what's something that you would like them to know or to hear?
I would like her to know and to hear that these are people, that substance use disorder is a disease, and it is classified as a medical condition. And so these people deserve respect, deserve dignity, and deserve to have the supports that they need. And so by closing these safe consumption sites, you are effectively reversing all of the good that we've done in these recent years. And I think that it's going to be absolutely devastating. We are in a toxic drug crisis. We are in an opioid death crisis. It's a pandemic, and this is only going to make it worse.
Sarah, thank you so much for your words. It's really excellent. It's very empowering.
Thank you very much.
Okay, so maybe we should move a little, or this might be good. Okay, that's okay. Patrick Corbin here with Walking Radio. It's March 19th. We're at the Registered Nurses Association of Ontario Summit on Mental Health and Substance Use. And I am joined by a new friend who I will allow to introduce himself.
My name is Kathy Moreland. I'm a retired registered nurse, very long-term member of RNAO, and also a member of Mom Stop the Harm.
And can you tell us about Mom Stop the Harm?
Mom Stop the Harm is a group of not just mothers, but mostly mothers and parents and family members who've been impacted by the drug poisoning crisis, either through loss of a loved one or having someone who's actively still using. And our goal is to change drug policy and to support people who are grieving or who are living with someone who's using substances.
What are some of the policy changes that you're advocating for?
Well, certainly in Ontario, we've been lobbying very strongly for the continued use of the safe consumption sites or consumption and treatment services. We've also looking at decriminalization and also all of the factors of harm reduction, including treatment when people are ready for it. So we're advocating for comprehensive harm reduction strategies in all provinces.
And yet here we are. We're a few days away now from the slated closure of harm reduction sites and supervised consumption sites across Ontario. Can you tell me a little bit about your thoughts and emotions around that plan?
I have to say my initial reaction to the announcement was a combination of shock, disillusionment, anger, and fear, all at the same time. Because our current government was voted in on the promise that they would not only continue with consumption treatment services, but also expand those services. And to take a complete 180 based on what we still don't know, what the information they were using, and to base it on the fact that they felt that they were, it was based on the safety of children that were within 200 meters of the sites, etc., is it just doesn't make any sense. And we know that people are going to die. Not only are people going to die, but the children that they say they want to protect are going to be exposed to more needles and actual drug poisonings in sight. It's going to have an impact on our emergency rooms and on the families of those people who are struggling and maybe not ready to get into recovery at this point, or not ready to quit at all. So I have really surprised. I think they're violating people's rights to have safe treatment because I guess for your audience, I want to clarify that talking about consumption treatment services doesn't mean you condone drug use. It means you accept that it's happening and that people are dying because of the toxic drug crisis, and that consumption treatment services don't just witness someone using. First of all, they do not provide the drugs for the person, but they, if someone takes something that is poisonous, then there is someone immediately there to help reverse that. There's never been a death in a consumption treatment service site anywhere in the country. They also provide the relationships needed to help people believe that they can actually move forward if they're ready to go to treatment. So they provide wound care, they provide a sense of belonging, they provide much more than just needles and paraphernalia. They provide the relationship that makes a person feel worthy of maybe getting treatment. So I get pretty emotional about that stuff. Just so your listeners know, I lost my son at a month after his 18th birthday as a result of fentanyl poisoning. And that was almost 5 years ago now, during COVID. And it's just one part of harm reduction that is so important. So for our government to withdraw that, to me, makes a statement that people who are using substances are disposable. They're disposable. And that they don't understand the evidence. I am a registered nurse. I look at evidence, and the evidence shows that this is an important part of harm reduction and an important part of saving people's lives and taking them where they're at.
One part of this process has been, you mentioned the health minister, Sylvia Jones. She said a couple months ago that people aren't going to die, which is hard to imagine. Is there something you would like the Premier, the Health Minister to know?
Well, people are still going to die, even if we keep safe consumption sites open. We know that people are still going to die because a lot of people still use in the privacy of wherever they're living. A lot of people who are using are dying on first use. But for the people who use safe consumption sites, they're usually our most marginalized users who are already struggling. And those sites were in the places where those people live or don't really live in homes. But for our homeless, for people who are experiencing homelessness, or for people who are really need those services and don't have access, those people are going to die now in Tim Hortons bathrooms and back alleys, and because just getting rid of those sites doesn't mean that people are going to stop using. But they are going to die now, whereas before things were turned around, and because of the relationships they built with people, they would be able to help them access services, which included housing, wound care, treatment options, and at the very least, the humanity of knowing somebody cared about them. So that's the part where I don't know how she could say that no one's going to die. Safe consumption sites aren't going to stop all the deaths from our toxic drug supply, but it will. My son's life was worth something. The 7 people a day who are dying, their lives are worth something. So if we knew that 7 people a day were dying from car accidents, we would want to do something about it. We basically, if 7 people a day were dying from toxic romaine lettuce, we would be doing something about it. But somehow these people are disposable because of stigma associated with illicit substances. So I don't agree with her, I guess, is my short answer.
Are there any other questions you wish I had asked? Or any final comments?
I just hope that people will understand that they have to reflect on their own, how they've developed their own opinions about people who use substances. Because it's not just substances, it's illicit substances. When you think of how we were raised to believe that people who use drugs are weak or should know better, I think you have to revisit and realize that alcohol still kills more people than opioids or the drugs that are out there on the street now. They don't kill people as quickly. And I think, but it's because it's legal, it's somehow okay. Carbohydrates are pretty addictive and they're killing people too. But somehow because of the fact that opioids are illegal, somehow it seems that people who use them are criminalized instead of humanized. And I think that's what I would ask people to think back of, how you were indoctrinated into what you believe about people who use substances, whether it's through what we watched on TV, what you see in the media. Maybe you had one of those relatives that struggled with substance use and that person was ostracized, and that's what you believe. I think ultimately we all feel helpless in this crisis, and some people turn that helplessness into disrespect and a lack of humanity, that somehow those people don't deserve to live. And to me, this decision about closing the safe consumption sites is a clear statement of, not only do we, it's under the auspices of saying we're protecting the public, they're saying these people don't deserve to live. And I do believe that the public needs to be safe, but those are still our citizens, even if they're not living in a way that we would desire.
And our friends and neighbors and loved ones. Kathy, thank you so much for sharing. It's very powerful.
Thank you for giving me that opportunity to share.